So what motivated me to get started with the pandemic was I knew that there were so many people out there who were not getting good information, and one way to help was to try to find the right information and direct people to reliable resources for that information. The advice that I would give people that's interested in getting started with helping with the pandemic is, since I'm a member of the NAACP, contact your local branch. They're doing plenty of work in their local regions, and we're always looking for help. When I look back as a result of the pandemic and see some of the things we've been able to accomplish, I get a small sense of joy, but I also feel like we missed so many people. There's just so much misinformation out there, and I just wish there was more we could do.
I think for me, if someone was to come to me and just want to volunteer, or I ask that, hey, how could I get involved? The very first thing, just get involved. Take the initiative. Find that niche, because we all have a niche, and just get involved. It is, I know for me, to get out there and to help. I'll give you an example. In June, just past Juneteenth, I had an opportunity to speak at the Onslow County Juneteenth Festival. First time I've ever done it. And the outcome of the event was just phenomenal. And so just to see the community to come out and to participate and to hear my words, you know, that's a great impact. Then on top of that, our temple, we quarterly go out and landscape the historical cemetery there in Onslow County. So, you know, for us, that is something, you know, we just go out and you just be a part of it. Just take the initiative and get out there and do it. It makes a difference.
What motivated me to get involved with people during the pandemic, I like helping people. I learned a valuable lesson from my parents, who are now deceased, that you need to help people. If you help people, people are going to help you if there's a need. And so I learned early on to help people. And nearly everywhere I've been in my entire life, I have been a volunteer. From Europe to the United States, I've been a volunteer. Why is it important for leaders to get involved? We need leaders because we're going to pass off the scene one day, and we need to be the leaders for those that are coming behind us. If we don't lead, then nobody's going to follow us.
Our work at New Hope Clinic has been to serve those who have been unable to access health care. We've been working since 1998 to provide medical, dental, and pharmacy services for low-income, uninsured adults. And when the pandemic hit, we knew that our patients were impacted greatly. And then when the vaccines became available, we were so excited to be part of a solution for our entire community, not even just for our patients. So we recruited additional volunteers and reached out to many other community partners, senior centers, food pantries, NAACP, small private practices, to make sure that whoever needed a vaccine could get easy access, whether they had internet access or a car, that we wanted to help them get connected to that hope for moving forward. The advice I would give to someone who wants to help during this pandemic is, please, let's work together.
I feel that it is important working with the pandemic because in the future it's going to help limit the cases that's going on in the community. I feel very good about the work that's going on in the community. I work for New Hanover Regional, and we push the vaccine, and we just encourage people just to take it. Don't be afraid, just take it.
I believe that leaders have a direct responsibility when they come into leading folks. And I think I often tell other leaders that I have seen mine today. And mine today have seen all of my yesterdays. And I don't want my yesterdays to be a negative approach. I want my yesterdays to make sure we do something positive in our today.
I think it's really important for leaders to get involved because they're trusted. They're seen as an extension of the hospital, the church, the community, and you have to have a leader to follow when it comes to things that are really important like the vaccine.
And my passion at the time was making sure that the seniors were taken care of. And so when the pandemic hit, I wanted to make sure that the seniors on the north side, where I stayed, lived, and worked, were taken care of. And so I partnered with several organizations and people in making sure that they got paper towels, sanitizer, masks, all of that. I even enlisted someone to make some masks for me. Oh my gosh. When I look at our community, so many people look to our leaders to lead them and make sure that, you know, the needs of the communities are taken care of. So it's important for the leaders to get involved and say, hey, you know, it's important for you to get that vaccination. Even today, I remember going into work and getting a phone call about so many people dying or about to die, and I just got chills and got overwhelmed by the whole thing. And so we're at a critical point where it's time for our leaders to step up and say, hey, enough is enough. We need to take care of our communities and make sure that everybody does get vaccinated. Thank you.
So when you saw things start to happen, and you saw the work you were doing pay off and people were getting vaccinated, how did that make you feel?
I felt hopeful that things were going to make a change. I've kind of been on it from two different sides, being an actual nurse in the hospital, caring for the COVID patients and seeing the fear, you know, in them, and then, you know, them realizing they were going to be okay. Some got to go home, fortunately, and then the clinical research that I do, you know, knowing the other side of the vaccines and what goes into it and the trials and stuff, you know, I felt like I could get that out to the public and encourage them to get vaccinated. So I was very just hopeful about that I could do something to help my community.
One of the reasons I got involved, and I got involved early on because I was hearing a lot from the community about access to the vaccine. People were frightened. They did not know how to get access. They thought they were getting left behind. So there was definitely a gap in our community, and especially within the Black community, and especially with the seniors at that time. Because I would hear, you know, that they didn't know how to use the phone. And when they did call some of the areas, they would get placed on hold or given this number system that they did not know how to use, so they would just hang up because of their anxiety. And so they were frightened and afraid they would get left behind. So one of the things that I wanted to do is make it personal, and I wanted to be able to let them call me, and I gave my personal cell phone number so that I could decrease their anxiety, make it personal, and I try to have a connection with them and just tell them, you know, was able to register them, told them that they're registered, and a lot of people could not believe that they just called me and got registered. I heard one lady was actually crying because she had been trying. I actually had someone calling me from Atlanta, Georgia, trying to get her mother registered. So it was just the community outreach And then one of the things that I was glad that I could make them feel comfortable, that they could go to sleep that night knowing they had an appointment.
My name is Deborah Dix Maxwell. I'm president of New Hanover County NAACP, which is my primary duty in the community. What elected officials can do to help during this crisis, some of the things they've done, which I think is great, is implemented the mortgage assistance program in this county. Each county has not done that. We've also had other efforts with them. But one thing I wish they had done, which some other communities had done, was distribute masks. The Hanover NAACP has distributed over 10,000 masks or more in this community. And I've seen cities like Newark and Greensboro distribute those, because that is one of the major means of quelching the pandemic and spread. The first advice I would give to someone is please get vaccinated. I realize there are breakthrough cases, but it's best to be vaccinated. Consider vaccinating your family, and please practice the 3 W's. Wear your mask, wash your hands, and stay 6 feet apart, because we are not through with this yet.
So, Panza, tell me, what motivated you to get involved with helping people during the pandemic?
What motivated me the most to help people during the pandemic, I wanted some type of normalcy. Not that it was because of my job as a public health nurse, but it was something different. It was something unusual, unknown, and it was frightening. And having a father who is elderly, and being involved in the community, my church, everybody there, I'll say majority, are elderly. So I wanted to help, my community. I'm originally from Wilmington, and I know a lot of people, so I really had a vested interest in the community, just to help and educate and just provide a service to everyone. My phone was blowing up. I didn't care, because I wanted to help.
My name is David Satcher. I'm retired. I'm the former director of the Satcher Health Leadership Institute at the Morehouse School of Medicine. I've been here at the Morehouse School of Medicine since 2002. Prior to that, I served 4 years as Surgeon General of the United States, and prior to that, 5 years as Director of the Centers for Disease Control, the CDC. In order to achieve health equity, we need leadership. We need leaders who care enough. We need leaders who know enough. We need leaders who have the courage to do enough. And we need leaders who will persevere until the job is done. Those are the kinds of leaders we're trying to help prepare, develop, and that's the kind of leadership we're trying to offer. Optimal leadership.